Sarah, thank you so much for being here.
Thanks for having me.
So much of what affects the health of the population you serve is outside the scope of the traditional health system. Access to food, housing, can people afford medications? Centene takes an expansive approach to providing care. So I want to ask you what works. How much do you know about the circumstances of your 28 million members, and how do you effectively address those needs to improve health outcomes?
Yeah, well, I think it's interesting. This conversation around drivers of health or social determinants of health, I think, has been emerging over the last couple of years, although the data has been very clear for a long time, that the vast majority, 80%, ballpark it however you want, of health outcomes are really driven by factors outside of the traditional healthcare delivery system. But I feel like we're only just recently, as an industry and from a policy standpoint, at a place where this has become an active dialogue. And from our perspective, that's incredibly exciting. But we need to do more than just talk about it. And so, as you said, Centene, one of the things that I found when I joined Centene 3.5 years ago was that intuitively, this was something that the organization understood because of its origins, right? So we have been in the Medicaid business for 40 years, and our focus, sort of the unique platform of Centene, is that we focus on government-sponsored programs. So we serve 28 million Americans in Medicaid, in Marketplace, and Medicare. Our customers, our members, are among the poorest and the sickest and the most underserved in our communities. And so this question of what works really matters, because we are also, by virtue of being focused on government programs, essentially stewards of taxpayer dollars. And we are asked by states, we are asked by the federal government, we are asked by CMS through the subsidized population for Marketplace to go out and figure out how best to support our members and essentially to deliver health outcomes. And so this question of what do you apply the dollars to that actually best deliver and best buy health outcomes is a question that, again, it was sort of intuitively native to the organization. And it's interesting, so there's a health affairs article that came out in 2021 that I think has been far too overlooked for, I think, how insightful it is. There was a group that went out and did a bunch of polling. And they went out and they asked Black female Democratic voters and white female Republican voters in North Carolina, and swing voters, Latino swing voters in Seattle, and male Republican voters in Dallas, Texas, the exact same question, which was, if you had $100 to spend to buy health in your community, what would you spend it on? And every single one of those groups had the exact same answer, which was that they would put 2/3 of that $100, $66, to housing, food, childcare, jobs, and only $33 to more health care. Mm-hmm. And so our members, Americans know what makes a difference in terms of health outcomes, and we just need to listen to them. And so that's really been how Centene operates. We work directly in our communities, and we, of course, make sure that there is access to health care, but we also think about what are those things that are going to actually drive health outcomes. And so when you're dealing with, for example, postpartum moms, yes, we want to make sure that they have access during the pregnancy to good prenatal care. They have access to doulas and to midwives and to great hospitals. But afterwards, we want to make sure that they have access to healthy food and diapers and basics, where if they can't, they don't have access to transportation, how do we get them in for a postpartum visit? So those are all the things that Centene has really been focused on in addition to traditional healthcare access.
And how do you connect members to those things, diapers or transportation, whatever it may be?
Well, that's part of our local approach. We've always been local in how we approach healthcare and making sure that we have team members who live and work in the communities that we serve. Mm-hmm. And so our team in Nevada funded a diaper van that goes out and literally delivers diapers to members. Our team in Delaware, so Delaware just passed an 1115 waiver to focus on healthy nutrition and diapers for new moms. And our teams are already organized around that because we actually do that in multiple of our states already. Healthy food drives, making sure that we will fund internet access for members and community partners to allow for telehealth visits. So it's just a lot of thoughtful community investment as part of the total calculus of getting healthcare outcomes for our members.
Great. And I want to come to the audience for questions shortly, so be thinking about them if you have questions for Sarah. And one barrier to health for many in the Medicaid population is sort of the lack of affordable housing. I know this is something you're passionate about. We've seen other insurers invest in affordable housing, but you are trying something new, and we're lucky enough to hear it here first. So I hoped you could tell us about it and why you're doing it and what's different.
Yeah, absolutely. So we're very excited about this. We've talked a lot at Centene about partnership and having really strong local partners who believe investing in our communities with us. And to your point, one of the biggest barriers is access to stable, affordable housing. And one of the barriers to the development of affordable housing units is actually the bottleneck of pre-development dollars. And so one of the things we're announcing today and really excited about is that the Centene Foundation is partnering with McCormack Baron Salazar, MBS, which is one of the nation's leaders in the development of affordable housing units and in urban revitalization. And together, addressing the pre-development funds, we are going to unlock $900 million worth of development projects across the country, focused particularly on the communities that we serve. And importantly, not just create thousands of affordable housing units as a result of this, but it also creates a platform where we can deliver community services that are, again, critical to those other drivers of health. So think about grocery stores in food deserts, community health clinics, community activity centers, early childhood education, and some of those other critical services that really surround the affordable housing and sort of the health journey of our members. So we're really excited about this partnership over the next couple of years, and I think it's a slightly different approach. For Centene, it's about doing a lot with a little, which is something that our members are uniquely amazing at, and I think speaks to our mission of transforming not just healthcare, but transforming the health of the communities that we serve.
Great. And raise your hand if you have a question. I'm going to ask Sarah about, we worry about people falling through the cracks, especially over the past year with what's been dubbed the Great Unwinding or the redeterminations, 94 million Americans having to go through the process of re-enrolling for Medicaid or lose their coverage. Meanwhile, a recent study found millions of Medicaid beneficiaries weren't even aware they had insurance. Can you tell us, how do you engage with your members, one, to make sure they understand the benefits they have, and then to make sure they understood the re-enrollment process? What were the challenges and how has that gone?
Yeah, that has been a major focus of ours over the last year, and actually for almost 18 months leading up to when the redeterminations process started. We did a huge outreach campaign. Within the first month, we had already done 9 million calls out to our members, and that rate and pace just continued through the process, whether it was phone calls, mailings. We actually got to text, so I want to come back to that because that was a pretty important thing. We did 15,000 community events, again, just in the first couple of months, partnering with those institutions and those community partners that are really good conveyors of information and education, whether that's churches, pharmacy partners, clinical partners, really making sure that our members understood what was coming, they understood the process, and to the extent that we could, partnered with the Medicaid agencies to help our members through that process. And we were certainly not alone in that. I think the industry stepped up broadly in a big way, but it is a consistent challenge in making sure that we can communicate with our members the way, frankly, they want to be communicated with. So one of the challenges coming into redeterminations was the TCPA and the fact that it actually precludes us from directly texting members. And so Congress sort of waived that through this process, and the chairwoman of the FCC did some awesome work to make that possible. But I think it speaks to the fact that in many ways, Medicaid is due for a modernization, not just from an infrastructure standpoint or a process standpoint, but frankly from a consumer standpoint, right? To think that our Medicaid moms are not attached to their phones, to think they're not juggling 8,000 things is completely naive. And we need to be in a position and be able to be in a position to serve them and to support them the way that they want to be supported as consumers. So I think we saw some great strides, but it's an opportunity to push that forward.
Great, and we have a question over here.
Hi, my name is Tim Leshin. Excuse me. I work for the Association of Schools and Programs of Public Health, and you're describing is a very public health approach, which is fantastic. Can you talk a little bit about how we can scale this model in order to have even a broader impact across the whole country or the world, potentially?
Yeah, I think so. So two things. One is, to me, scale is kind of the power of the fabric, understanding that healthcare and public health is local in delivery and in sort of nuance, but then how do you extract and extrapolate best practices, right? And so the first thing is making sure that we have an integrated approach and that we embrace this idea that the drivers of health are not just some buzzy progressive way of talking about healthcare. They actually work. The math works. And we should be investing from a public dollar standpoint in health outcomes in this way. And then I think the other bigger answer, longer answer, but I'll make it pithy, is data. Because if we have broad access to data and we do the work to make that data liquid and to really look at it, not just around local best practices, but then is there connectivity, where do you get scale and proof about what should be sort of standard of practice, that's how we're going to start taking some of these great local innovations and pushing them out across the country and across the world. And that is really sort of at the core of Centene's thesis, which is our platform of 28 million Americans in 50 states. We see where the innovation is, and we have that data, and being able to pull that up and integrate that into the conversation, whether that's policy, operations, service, that's really how we innovate.
And quickly, before we're out of time, we got to.
Hi.
Oh, sorry. Okay. Question in the back.
Very quickly, you mentioned scaling. I wonder how you are working across states, because your 50 states, only a few of them have those 1115 waivers like you just mentioned. How do you work across so many states that aren't even hadn't expanded Medicaid at all? And how do you get the social determinants into those places?
Well, so it's a great question. Part of why I am so enamored with this polling that was done is that, to me, it is proof that while 1115 waivers certainly are increasing in their adoption, that sitting in 32 states for Medicaid, very different politics, but when you get on the ground, there is not actually a difference in terms of what people know makes a difference. And being in a managed care spot, we can actually direct those dollars and create the proof points and then move the conversation regardless of the politics.
Great. Thank you, Sarah. Good note to end on. And thanks again for being here.
Thank you.